Our project aimed to achieve an improvement in the time it takes patients to get their diagnosis for head and neck cancer. And then the second part of the project was we would hope that would then also translate into them getting their treatment sooner. So when we started this project, it was taking around about 62 days for patients to receive their decision on how you're going to treat their cancer. But the ideal performance metric for this is 28 days, and that's a sort of recognised national standard. So there was a real importance to get this project underway and to see if we could do anything to improve. There'd been quite a few times that other agencies had come in to try and improve it because it wasn't performing so well, and they hadn't changed it at all. In fact, it was beginning to get worse. The other issue with the cancer pathway is we asked these patients to make about 7 journeys at least to the hospital in that ideally 28-day period. And that's across so many different silos, directorates, departments, from primary care to radiology to cellular pathology. And each department feels they're doing their bit and they're doing their bit well, but collectively it wasn't adding up to a patient experience. So we had to sort of achieve that collective responsibility. And that was going to be difficult because these teams always works in separation. They don't really get together. And this project gave us the opportunity to bring these teams all together to try and improve that collective improvement for the patients and more patient-centered. You think you know all about the problem, but you don't. You need everybody in that system, and everybody's voice is equal and equally important. We understand now that not a single patient knew they were on an urgent suspected cancer pathway, never heard the term. That impacts on how patients engage in the service. If they don't know why they're being seen so quickly, they'll quite often cancel the hospital appointment for something else. So there was that understanding which maybe with the hierarchical nature of healthcare, where people tend to feel they can't speak up necessarily to hire people up the chain. Getting rid of that, got rid of those barriers and allowed for real improvements right down to the detail to flourish. So we've seen a lot of success in our project now. We're now hitting those performance targets. We would like for us to achieve the 75% of patients being treated within 62 days. We're very, very close, and that will probably just happen naturally. The team are also planning on spreading their information, so they want to develop more insights into the impact the work has had. They've learned that it can work. So there's very much a willingness now to want to really get into the quality aspects, not just the performance side, and to maintain that momentum, not lose those gains, and also then to spread far and wide, particularly nationally. Advice on this would be to get involved, see that there is possibility that maybe you don't realise. Sometimes these problems look too big, too complex, and you feel there's nothing you can do to make a change, but there is. You can get involved, you can start small, you can influence, and you can build, and it's those small steps that gradually over time, it's taken us 2 years to get there. We didn't see much progress at the start, but we kept on just plugging away, and the results came eventually. The reason I love to do this work is you just see the morale of these teams just going from rock bottom to sky high, the pride they feel in the work they do. That's why I really enjoy doing this work. That's what I'm most proud of.